Okay. Alright, so I'm recording, alright?
Okay.
So, doing my second video out of 4. This is my administering IV medication via mini bag. Alright. First thing is you always have to check the doctor's orders. So, always want to double check and make sure that it is the right dosage and right patient. And what I'm doing today for meds is vancomycin. And it is an antibiotic, and what it does is it binds to a cell wall, and what it does is it ends up lysing, and it is particularly effective against gram-positive pathogens. Recommended dosage is 500 milligrams every 6 hours and 1 gram every 12 hours, but you can give up to 4 grams a day. Side effects is nausea and vomiting, ototoxicity, nephrotoxicity, and hypertension. Contraindication includes hearing, renal impairment, and hypersensitivity. Implications is that vancomycin must be given orally for C. diff, and any other organ-living pathogens must be given through IV, and it has to be given at least for 60 minutes. IV is available in 500 milligrams, 750 milligrams. Vials come in 1 gram, 5 grams, and 10 grams. Okay, so what I'm going to do is I'm going to go ahead and do the calculations, which I've already done. So doctor's orders 500 milligrams every 6 hours. What I have is 500 milligrams and 2 milliliter fluid. So, and the drops per minute is 10 drops per minute. And overall, I ended up I'm supposed to draw up 2 milliliters and be giving 1 drop per minute. Okay, so I pre-filled my medication here, 2 milliliters. Got my saline, 6 milliliters. And what I'm going to do is I'm going to assume that this is a 100 milliliter mini bag. Okay, so let me do my hand hygiene first. Put my gloves on. Well, I don't necessarily have to put gloves, so here we go. What I'm going to do is have this bag and I'm going to clean it. And here we go. I'm going to add the medication. Shake them. Alright, so this is good now. And what I have to do now is prime it. And I'll be doing with the primary tubing. So this is it right here. And make sure you always label them. Label your IV meds bag and your tubing. I always forget to do that. My goodness. Okay, here we go. Alright. So what I'm going to do, have this right here, and I'm going to poke it in. Now, first thing you want to do, once that's done, go ahead and lock so that the fluid won't come out, which is locked. That's good. And first thing I'm going to do is prime the bag. Okay. This is sterile, so you got to be careful. Okay, so it's primed. Should be in there. And then of course I'll be once again labeling them. And I'll set this aside. And with all this, what I'm going to do is I'm going to go ahead and go up to my patient, knock on the door, go in, introduce myself, and tell him that the procedure is going to be vancomycin antibiotics through IV. And the side effects, if this person has any allergies, always check your the two identification, which is the name and birth date, most commonly. Alright, so this is what I'm going to do. Put my gloves on first. I'm going to double check if there are any distension, phlebitis, or infiltration to my INT. I don't see anything. Okay, so what I'm going to do is clean the port. And by doing the ASASH method, which is aspirate, saline fluid, administer saline fluid, and heparin. So, here we go. Maybe you can see. What I'm going to do is aspirate. Yes, negative pressure. Now what I'm going to do is go in, slightly 0.5 milliliters every time. And then applying positive pressure, I'm going to lock it. Take this off. Now, medication. Go ahead and I'm going to go ahead and set my drops per minute, which is 1 drop, and it's going to take me forever to actually calibrate. So let's just say that we did this, and I'm going to go ahead and check for anything that's abnormal. And what I'm going to do is take my gloves off, do my hand hygiene, and then wait till this is done. And once I'm done, I come back and do my hand hygiene again, put my gloves back on, and what I'm going to have to do is make sure this was done, and I'm going to go and take this off. All right. Leave that to the side, and go ahead and do saline fluid again. Good. Going by 0.5 milliliter increments. Going in. And apply positive pressure and lock. Take this off. After this, on doctor's orders, I'm supposed to give heparin, but for this purposes, we won't give heparin. Also, what I'm going to go ahead and document is I'm going to document how the IV side was, if there are any abnormalities, such as phlebitis or infiltration. What I'm going to do is, based on my MAR, I'm going to go ahead, write down my dosage, route, time, date, also the patient's initials and my initials. And the final thing is I have to do the intake and output for the patient and how the patient has handled it. And that'll be all.